My name is Emmanuel. I'm a CHESA alumni. I did my CHESA fellowship from 2021 to 2023. And I have been involved especially in mentoring others and inviting all that I could to join the CHESA family. I am a general surgeon, but currently pediatric surgeon, pediatric surgery fellow. And all this is done to, improve access to pediatric surgical treatment in my region. Yeah. It's amazing that some things are driven by the need. To be honest, pediatric surgery was not my very first choice years ago. But as I kept working and interacting with patients and looking at all the inequalities around the places where we work, I felt there was a very big gap in access to care by the children. Not many people are interested in treating children, especially with surgical conditions. So in a way, I had to stand in the gap and address this need. And that is why I ended up in pediatric surgery. My fellowship with CHESA was general. And it came at a time, like I said, it came at a time when I was at that part of my career where I began to question the work I was doing. I reached a point where I was operating a lot and I thought that all solutions to patients' problems were in the clinic or in the operating room or in the wards. Previously, that's what I thought. So I worked so hard. I operated day and night, thinking I would solve patients' problems. But then I began to question everything I had spent my energy on. And I began to wonder whether it's making a difference or not. And that's the time I joined CHESA. During this time, I needed to look more, to pay more attention to not just the clinical entities, but also the structure, the things that contribute to sickness, the social determinants of sickness. And that's where, issues like structural competence came in, and I began to pay more attention even to other things that are non-clinical about patients. The big gap I saw was mentorship. If we had to bridge a gap, we had to mentor other people. We had to pick people by their hands and, show them the way to go. We were grossly understaffed. I had a few students around me, and that's all I had. So I began to interest residents into what I was doing. And I'm glad that it's already bearing fruit. Even before I became a pediatric surgeon, I have been able to mentor quite a few people to do the work that I'm doing. I think the biggest inspiration for me to join the CHESA program was that its values aligned quite well with what I personally believed. Particularly, I was interested in a program that helps me to see beyond patient sickness, a program that is going to help me look at the social determinants of health and disease. And in CHESA, I found that. But not just looking at what causes sickness to patients, but also solutions, finding practical solutions towards challenges. And that's what really inspired me about joining CHESA, because much of our values quite aligned well. Yeah. One of the advantages of doing a fellowship at CHESA is you get to meet so many people with influence, people who are willing to pick you by the hand. In a way, as you try to support others, you have others supporting you. And I think outside the fellowship, I have learned that we need to work together. I have met people who have helped me to propel me. I have got mentors in pediatric surgery. The CHESA directors themselves are pediatric surgeons. They have been very helpful to me. But also, I feel like I have grown a community. I have a community around me. So I no longer feel like I'm alone anymore. I feel like I have people around me who can help me to achieve whatever it is that I want to achieve. One of the advice I would give for people who are applying to the fellowship is there has to be a need that is generated from within and not imposed from outside, because I have met many people who want to join the CHESA fellowship, and then they keep asking me, what is it going to bring? But I keep telling them, I think you need to look around yourself and generate that need. And then CHESA will only come in to support that whatever project that you have and whatever need you have identified, they will come in to support you. But it wouldn't be good for that need to be imposed on you from CHESA. I think I want to speak, it wouldn't be so good for me to leave without speaking to the people, especially those who look up to me. My story has been a long one of so many struggles here and there. I haven't given up, but after achieving everything that I have achieved, I feel like I need to give it away to those that are coming after me. And that's the message I would wish to pass to all those who wish to follow my footsteps. Be willing to give up everything that you have achieved so that there is continuity.